up in the WCT viewers in this one?
Yeah.
Okay.
If for some reason I forget, don't wave at me, okay?
And we're gonna go, live at 5.
Okay.
It's gonna be like we're in.
Yeah, stream has started on WCT. Good.
Seconds. Six, 5, 4, 3, 2.
Good afternoon. I'm Cookeville Mayor Ricky Shelton.
And I'm Putnam County Mayor Randy Porter. Before we get into our COVID-19 briefing today, I want to remember our tornado survivors. 1 month ago today, our county was shaken to its core by an EF4 tornado. The destruction, injuries, and loss of life was devastating, like our county had never seen before. What came next was an outpouring of love, support, and care for all the victims, survivors, and families affected by the horrific storm. Neighbors helping neighbors, friends helping friends, and strangers helping strangers. What a great community we live in. To the survivors, as we continue to work together to recover, clean up, and rebuild, just remember, we are still there for you. We have not forgotten your terrible loss and heartache, and you are on our minds daily. We will continue to do everything we can to help you and hopefully ease some of your pain. If you have any needs, please call us. Our helpline is still open at 931-646-4636 or on our website at putnamcountytn.gov/survivors.
Yes, as he mentioned about the resources, again, make sure you call 646-4636 and register if you have not done so. We hope everyone has, but make sure you do that so we can get in contact with you and keep in contact. Also, the distribution center is still open and available with resources, financial aid, and then, of course, the relief fund. The relief fund board has defined the application process, and they are working to get the applications out to each of you next week, and that's why it's very important that you register on that line so that they can get that to you. Mayor?
We just asked everyone to keep all those survivors and their families in your prayers as they go through this difficult time. Our community is in recovery and cleanup process that continues, and we'll continue to be there for you. Both Mayor Shelton and I and all of our city and county officials and department heads are there for you if you need anything. This is our COVID-19 coronavirus community update for Friday, April the 3rd. Today, as of 2 p.m., our total number of confirmed positives in Putnam County is now 50, which is 13 more than yesterday. The other counties in the Upper Cumberland that have confirmed positives are Cannon with 4, Clay with 1, Cumberland with 22, DeKalb with 5, Fentress has 1, Macon has 7, Overton has 2, Smith County has 3, Warren County has 1, and White County has 2. Again, Putnam County has 50 confirmed cases, which is 13 more than yesterday. But I want to warn you, this number does not have all of the cases from Signature Healthcare in it yet. Those will be coming sometime over the weekend or first of the week. As I've been telling you each day, we can only report the actual confirmed cases that have been verified by the State Health Department. We know these numbers are sometimes lagging based on the number of tests that are performed on a daily basis. Our health department had its drive-through today and assessed almost 100 people with over 75 tests today alone. This doesn't count all the testing that's done by doctors' offices, clinics, and our local hospital. The number of tests being performed have been dramatically increasing this week, not only here, but statewide. We had over 300 tests performed on Tuesday alone by our local health department. In full transparency, I say all this again to prepare you for what's coming in the next few days. The more we test, the more our positives are going to continue to rise. The more positives we have, the greater the chance we have of spreading the virus. This makes staying at home and using good hygiene even more critical. As we've been telling you the past several days, this is going to get worse before it gets better, and we all have to work together to stop the spread. This is serious, so I'm asking you to please take it that way. Mayor Shelton.
Yes, this is in our community, and we must stop the spread. Yesterday, the governor issued a mandated stay-at-home directive, which means don't go out or leave your house unless it's absolutely essential. A list of defined essential businesses can be found at bettercookeville.com and click on COVID. If you need to go out to get groceries, don't take your kids unless there's absolutely no other option. One person in the house go instead of the family, one person, one cart. Or use delivery services or curbside pickup and online shopping. I implore you to listen, to follow the directives, and to take personal responsibility and heed the guidance from experts, and do your part to stop the spread. Use common sense so that you can protect one another. When you do come back and return home, you need to wash your hands and wipe down anything you touched. Mayor?
Also, we'd like to say a special thank you to WCTE for broadcasting our live updates each day. Becky Magura and her whole team has worked hard, starting with the tornado a month ago and working with us on a daily basis to make sure that they break into their live broadcast to be able to keep us updated. Becky, we thank you and all your team for what you're doing. Mayor Shelton and I have been talking to you about the COVID-19 virus for the past 2 weeks. I've been saying that we need to act like everyone you come in contact with has the virus. But I got a suggestion from a friend today that says we should act like we have the virus. Because if we all do that and act like we're all infected, then you should be doing everything you can to stay away from others to stop the spread. And I thought that was some pretty good advice. Mm-hmm. To get past this terrible disease, we all have to take this serious and do everything we can to fight it. We don't want you to panic, as we've said daily, but we need you to take this serious, and I have to say some of you are not. The next 2 to 3 weeks are going to be critical in fighting this disease. So let's work together like we always do to stop the spread of this dreaded virus. We are Putnam County strong, and we will get through this, but you have to do your part and work with us. Claire?
All right, I'll give you some updates on as far as the city goes. Cane Creek Park is going to remain open from 7 to 7. However, the main entrance drive-in gates are now closed. So you can park at Cane Creek Rec Center and walk in, just like, and hit the walking trail or enjoy other things. But there was too much congregation happening, so they've asked for that. Also, senior citizens can register for a daily check-in call by our police department. Again, you can go to bettercookeville.com, click COVID, and there's a link to this very nice city service that you can sign up for. Cookeville Regional Medical Center updated me. They currently have 4 inpatients with COVID, and they have 1 that has been discharged. CRMC also has had 3 employees that have tested positive, and they are quarantined at home. As we talked about the state directive, there was another directive issued. All state parks are going to close tonight at midnight until further notice. There was just, again, they said too many people coming, more so from even out of state, Mayor, they said. And so they just, and I know it had been seen at our Cummins Falls here as well, a lot of out-of-state cars. And so they've just asked and decided, and they will close tonight. The directives on essential businesses, these can be found again at the site I just told you about. There's a couple. You can also go to the Tennessee State site, and but there's a few things to note. The executive orders, there was the 17 executive order 21, 22, and 23, and they dealt with different things pertaining to essential businesses, and then it changed. It was originally a suggestion to stay at home, and now it's mandated to stay at home. But the list of essential businesses is very large. I know we've had a lot of calls. Yeah. We've had a lot of questions. What does this mean for me? What does this mean for my business? What does this mean? Am I supposed to still go? Do I have to have a placard? Do I have to have a letter from my employer? Mm-hmm. There's so many unanswered questions, and quite honestly, we don't have all the answers. No. it's very difficult in some cases to interpret this. And so what I suggest you do is read those. And again, we've posted them, and I did another post today about them and tried to explain it. I saw another post today that an attorney, a local attorney in town, Brett Knight, just to try to help explain some of it, he actually went through these orders and then kind of just said, so here's what this says you can do based on the essential activities that are still open. So again, we don't need to have papers to travel. The National Guard is not being deployed to enforce a curfew or stay-at-home order. We're not having a curfew or stay-at-home. But the essential activities, for the purposes of the executive orders, the essential activity means you can go get stuff for your health care needs or other people's health care needs. You can go to the grocery store or Walmart or get spark plugs for your car at the auto store. You can get your food, packages, or whatever you need delivered if you don't want to go get them by yourself. You can pretty much go outside and do anything you want, including go for a drive to see the trees blooming, so long as you practice these health guidelines, especially the 6-foot distancing. Turkey season begins tomorrow, and the state website has reiterated that hunting and fishing are the essential activities listed and are allowed. Also specifically allowed driving, riding in a vehicle, walking, hiking, running, biking, swimming, kayaking, canoeing, golf, tennis, or other sports or recreational activities that can be performed while maintaining the aforementioned precautions. You can visit your friends and family if you want. Again, you should maintain that distance. You can, and in addition, you can engage in essential travel as defined below. You can go to your essential job, even if you don't want to. You can drive to all the things listed above. You can go take care of people. You can both leave and enter the state of Tennessee. You can drop off and pick up your kids. Now, let me say this. Obviously, that's a very broad, very wide-ranging list of items.
It is.
I would just say this. If we're going to stop the spread and we're going to try to make a difference here, just because you can do it doesn't mean you should do it if you want to make a difference and you want to protect yourself and your family and everyone else. And so I would just say, I mean, certainly we're not advocating staying in your house and locking the doors and pulling the blinds down. That's unrealistic because that creates a whole nother list of issues of seasonal depression and all kinds of things. You know, walk around your neighborhood and do those kind of things, but just let's try to use common sense and, again, do what, as the mayor said, act like either you have it or act like everything you come in contact is infested with this germ. And then if you'll do that, you can do some of these things. Okay, drive around in a car and look at the pretty sights. But, again, use common sense.
That's right, Mayor. And if everyone will do that, we work together so good as a team in Putnam County and Cookeville. If everyone will do that and use common sense and try to be respectful of others is a big part of it, too.
That's right.
We will get through this.
That's right. I will now ask Lee Rooney, CEO of Signature Healthcare here in Cookeville, to update us on the developments at his facility.
Good afternoon, everyone. My name is Lee Rooney. I'm the CEO here locally at Signature Healthcare of Putnam County. I want to first thank Mayor Shelton and Mayor Porter for the great work they do. It's a tremendous honor to be able to be here to share my story. I thank them for the time that they're giving me, and I want to congratulate them on the great job they do every day. They've been a great resource for me. I want to start by updating a little bit of what we talked about yesterday when I was here. My facility, starting on March 9th, we followed the directives of the CDC and everything that was involved through local health organizations, Department of Health. We locked down our facility and we made sure that anybody coming into our building at that time was only essential or emergency, which included just staff members. From there, we made sure that all employees were signing in, their temperatures were being taken, they were going through the protocol of did they have any symptoms, and made sure that anybody that was showing any signs or symptoms was not permitted to come in. So with that, we felt we were doing everything we possibly could, and I do believe we were. So it was approximately last Friday, so you're talking almost 3 weeks after the time when we started that process. where we recognized that there was an elder that had symptoms that fell into, could this potentially be COVID? And we tested that person. We put them in isolation waiting for those results, and those results came back this past Friday. So you can see the time frame from the time we started March 9th to the first positive case being Friday. At that point, we were having conversations. We were preparing. My medical director and I, Dr. Richards, were in communication daily. We were making sure we had a plan in place that if this did spread, which we were preparing for because we knew how it was moving in society across the United States, and we always want to make sure we're prepared for the worst. So with our conversations, we knew that if we had another positive case, we were going to push for facility-wide testing, which we did. And we thank the Department of Health, our local Department of Health, and those in Nashville. They saw the urgency that I encouraged, that we needed to make sure of what we had in our facility. So with that, we tested every employee and every patient, and this happened this past Tuesday. So that progressed pretty quickly, and the Department of Health was fantastic in the work in doing those things. We got the results virtually the next day. There was some that was coming in a little later, and then the results that I shared with you yesterday with 28 confirmed patients and 16 confirmed stakeholders. I did get word late yesterday after our conversation that we had one patient that was inconclusive, and I got informed that, and we had that patient on isolation procedures. That test did come back positive, so that increases my numbers by 1 today. I'm thankful for the care that they're being provided. I have an unbelievable team, nurses, CNAs, dietary, housekeeping, maintenance, everybody is phenomenal.
Absolutely.
And it's because of them that we're able to handle this situation as we're handling it right now. We were prepared, and now we're maneuvering to make sure that all these patients are put into an isolated location, and we're moving yesterday, today. This should be completed, have all elders in one location effective the end of the day today. We're in constant contact with the families. We're updating them on their conditions. I can gladly report that there's only one of the 29 at this point that actually has symptoms related to COVID. The remaining 28 do not show the symptoms that if they weren't tested already, we would not know they had it. So we want to make sure the families are aware of that. This is a difficult situation. I would not want to wish this on any facility. It is extremely difficult. Every day we're dealing with death and dying in the elderly, and we're taking care of the sickest of the sick. So a normal day is always difficult. My staff love our residents, and they would be devastated if they thought they had a hand in bringing this in, and that's what we're talking about today. You have to assume that you are positive and keep distance. Now, in healthcare, we can't always do that. We have to be in there. And in a nursing home like my own, in my company, Signature Healthcare, we create a home environment. We make sure that they are loved, and up until just recently, we provide hugs daily. We pats on back, braiding hair, brushing, bathing. We're as close as anybody is with their own family. And it's because of that, if you don't know you're positive, it could turn into a situation like this. So I implore everybody to be careful. Again, I wouldn't wish this on anybody in any facility, and I hope it doesn't, but we need to be careful, and there's a good chance it might. If it did have to happen to one facility, I know my facility is the one that could handle it. I have tremendous support from my corporate office. I have a tremendous team, and we are managing as best as we can, and I think we're doing everything we possibly can do. We have grown our facility to be a 5-star facility. What that means is the CMS rates facilities all across the United States, and our facility is actually in the top 10% of nursing homes in the United States. So there's tremendous resources in this community meeting the needs of our elders. As healthcare, employees, those that go into healthcare, it's because it's a calling and they feel it in their heart, and it's just something, just like being mayors, it's a calling, and you have to have it in your heart to do the job correctly. That's what my staff is. It's a calling to them. And because of that, we're putting ourselves in positions to potentially be infected, just like those that work in the hospital, other nursing homes, home health, hospice groups. We're at risk every day. And because of that, we not only go to work and work long, hard hours right now, but when we go home, we're quarantining ourselves. So I have 3 children. It's not easy. And when you go home at night, you're generally alone to make sure that you don't infect anybody else, because I have to pretend or just think that I am infected myself. So right now, the best part of my day, I got a 10-year-old and she's leaving me little notes, just wishing me luck and doing the good job and making sure that I'm safe. And that's appreciated. And, you know, if you want to do your part right now, if you're not in healthcare and you don't have to be exposed, then stay home. But the longer this takes to clear up, the longer people are walking around and have this and not know it, there's a good chance you're standing in line at a grocery store and the person ahead of you could be a nurse, could be a doctor, could be a CNA, could be a dietary worker that is going into a nursing home or healthcare or a home even to take care of an elderly person, and they won't know it. So again, the people I tested right now, over 90% is not showing symptoms, and we're doing everything we can to make sure that they're safe. So please, I implore you, do what the mayors are saying. Make sure you are staying at home. We want to make sure that this clears up, so that way not only can we get back to doing the normal things, but those of us that are quarantining, all the healthcare workers and the EMS workers, we can get back to being with our families too, because it's doubly hard for those in healthcare.
That's right.
I thank you for your time. I appreciate it. I know people will heed these warnings. We just need to do the best job we can. Again, if any facility can manage this, it is my facility in Putnam County, and it's because of my team. It's because of the direction of Signature Healthcare, and I'm grateful for the support, and I'm grateful for the support of local people as well. Everybody's been tremendous. So thank you. Appreciate it.
Thank you, Lee. I want to say that I appreciate Lee's transparency and his cooperation. I cannot imagine what he has been going through at his facility, but I've known Lee for a long time, and I know that they can take care of it, and they're doing a great job. He has a great team, and I appreciate what he's doing. And I know he's still working through some of the unknowns and what's going to happen with the virus, but I have full faith in Lee that his facility, that they're going to take care of this. Know that you have our full support, Lee. Your facility does, and anything you need, you let us know. I'll now ask our newly appointed Director of Schools, congratulations, Mr. Corby King, as he was appointed last night as our new Schools Director, to update us on the developments within the Putnam County School System. Corby.
Thank you. Thank you, Mayor Porter and Mayor Shelton again. Thank you both for the continued leadership for our community for the last few weeks through the tornado and now through this with the coronavirus. I want to begin today expressing my appreciation to the school board for giving me the opportunity to continue in this role as director. And I also want to say thank you to the community for the overwhelming, it's been a huge outpouring of encouragement and support that I've received over the past few days in this role. And it's really heartwarming, and I really appreciate that just in moving forward and supporting our community. And I'm really excited for this. In the midst of all the bad news and the difficult stuff that we're hearing today, I do want to share, people are looking for good news and good things. And if you're looking for good news, I encourage you, find a teacher that you're friends with on social media and look at their pages and see the things that are going on this week within our school system. Teachers that are making connections with students and students that are responding. There is good things that are happening and going on, and we can do that remotely. We can do that by staying home and staying safe. This week we began our remote learning plan within the school system. We've rolled that out. And in doing that, I want to highlight 2 of our teams. The first team I want to highlight is our school system VITAL team. VITAL stands for the Virtual Instruction to Accentuate Learning. This team's led by Mr. Sam Brooks. This is the team that's largely responsible for implementing or at least rolling out and preparing the resources of our remote learning plan. The remote learning plan can be found on our school system website, pcsstn.com, and in that plan, teachers can find resources, parents and students can find resources to continue educational opportunities. The Vital team continues to be available to support our school system and provide the resources that are there. So if you have needs, feel free to reach out to that team. The next team that I want to point out this week is our technology team. The technology team continues to keep our website up to date with the most current information surrounding COVID-19 and our school system's response. The technology team is also coordinated with school administrators and school staff this week to distribute the devices to students who need them. This week we have distributed 1,253 Chromebooks to students that didn't have access to a device for remote learning. The technology team is also in the process of distributing approximately 550 mobile hotspots. We've partnered with Verizon to provide hotspots to students who didn't have internet access.
That's great.
So we're continuing to try to get access and devices to families who need that. We do ask families to be patient with us. It takes time to set up the devices and distribute those. We're hoping to have them all distributed by the 1st of next week. That's our goal. And then again, for students who we just can't get access to at least with a hotspot or internet connectivity, we will continue to provide paper packets for those families.
Good.
I want to remind families again, as we begin implementing this remote learning plan, our goal is to support students and families and continue to provide educational services. We know education is really important to the Putnam County community.
Right.
Our goal and our intention is not to add stress to your home. It's just to provide a support, a break from all the other stuff that's going on, to connect with teachers for your students, to connect with their friends remotely, and do so in an environment where we're learning. Again, I want to go back and talk about our school nutrition team and our transportation team I mentioned last week. This group of people, I can't say enough about the support they're providing for our students and our families as we continue to feed children throughout this extended closure. As of today, our school nutrition team has provided over 88,000 meals, and I have that number, 89,486 meals.
That is amazing, Corby.
As of today, that our school nutrition teams have provided.
That is amazing.
We are so happy that the families are taking advantage of that. But I do want to say, is the number of families who are taking advantage of this, it did overwhelm our staff. We had begun at the beginning of this closure providing some door-to-door deliveries, and that did overwhelm our staff. So we have had to pull that back, and we're only providing meals at the stops that are advertised on our website. And if you need help finding a location or a bus stop in the community, call the school nutrition department, 528-1847, and they'll help you find a stop that's closest to your home to pick families up. Also, this group of employees are the ones that we know we're putting on the front lines in this. And they're scared, they're worried, just like the community. In looking at the governor's executive order yesterday, we want to continue to provide those meals. We believe that's essential to our community. But to the extent possible, we also want to limit exposure for those employees and for their families as well. So we have applied for a waiver from the department asking to scale back the number of days. Right now we're providing meals daily, and we will continue to do that until this waiver is granted. But if we receive that, we may provide multiple meals. So we might provide a Monday, Wednesday, Friday schedule and multiple meals on those days. So it'll still be the same number of meals for your families. We've not received that yet, but we're anticipating approval. And if we receive that, we'll communicate it to families via school messenger and our school system social media sites.
Right.
And again, the pickup locations can be found on our website, pcsstn.com. So again, in closing, I just want to encourage families, listen to what the mayors are telling you. Stay home, stay safe. We all want to get back out in public. We want to communicate together. We want to give everybody big hugs and shake hands, and we'll be able to do that if we stay home, if we're all responsible, we'll be able to return to those normal activities sooner rather than later.
Right.
So, Mayor, again, thank you for your leadership and guidance during this time.
Thank you, Corby, and we're glad to know that the school board recognizes the leadership that you provided our schools and the families you served during the tornado and now and during this COVID-19 pandemic. Both of them were unprecedented events in our community, and we thank you for all you and your team has done, and congratulations again on your appointment. I can't think of anybody any better to be heading our school system up, and we thank you for what you're doing. And folks, if you think about almost 90,000 meals that the school system has been providing out to our community, to the children and the families out there on a Monday through Friday basis, that's absolutely amazing, Corby. So please pass along to your staff what a great job that they're doing.
Absolutely. Thank you.
Now we have State Representative Ryan Williams to update us on the developments at the state level. Ryan?
Thank you, Mayor Porter, Mayor Shelton, for the opportunity to be here today. I can't reiterate enough how proud I am to be a Putnam Countyan and a member of the city of Cookeville. And you two guys, it's hard to believe that a month ago today we were on the phone together talking about a tornado. Had we, I don't think we would have known at that time what a devastating month it has been. But the good news is for Putnam Countryans and for Tennesseans is we have each other. And we knew we were a great community all along, and so it's great to hear all the things that we're doing, like Lee and his kids and his family doing what they're doing and the transparency they're doing. It's great to be King. Congratulations, Corby King, on your appointment. It's very well deserved, and it shows you the impact our local school systems have on our community when you hear of over 80,000 meals in such a short period of time. It just means that we're not just teaching children anymore. We're actually providing for some meals for them as well. I want to reiterate a couple of things. The governor did issue Executive Order 24 now, which is a new executive order today. It does help our law enforcement entities as it relates to employment, and so we're excited to see that. I think the governor's done a great job with that. It also expands the ability for us to do telemedicine and telehealth. That's one of the things the elderly population is always wanting to know, can we go to our appointments? Should we go to our appointments? And those kinds of things. What telemedicine and telehealth allows you to do is to get a consult from your doctor without having to go in and make yourself susceptible to those events. And so we'd encourage you, if you have a doctor's appointment, imagine instead of going to the doctor, you're just going to pick up the phone and call your doctor and find out whether or not you actually need to come in. It's very important that you do that. Telemedicine is one of those ways that we can do an essential business without impacting our community and our individuals that are at risk. And so we want to encourage you to do that. As was said earlier, and I was told as well, is if we all act like that we have the virus, then the quicker we're going to be able to get back to our lives prior to this. And so we can't encourage you enough. I told Randy when I saw him earlier today, or Mayor Porter, that I've seen wringing of the hands. It's great to see wringing of the hands these days. That means people are listening. They're washing their hands or using bacterial disinfectant. So it's really important. One of the things we also want to encourage you to do is to better adhere, as the governor said yesterday, to not going anywhere. One of the complaints that we also have is when you're doing essential business, you only need to send those family members that is essentially necessary to do the essential business. We don't need to send our entire family and make it a field trip in order to go to the grocery store. That's a great way where, as Lee was talking about earlier, we might have a medical professional in front of us who's already at risk every day. If we all act like that we have this virus and we do that, we will get back to our lives sooner rather than later. We will actually, by adhering to the governor's order, whether you agree with it or not, is not the case. If you don't adhere to this, we're actually saving our small business by adhering to it. We're actually saving the people that live in our communities, that support our ball teams, that go to the ball games with us. We're supporting them by adhering. And so I want to encourage you to do that. I want to thank the mayors for all they're doing, communication. I found out yesterday in communicating with so many people across the district is a lot of times people look for this as a member of hope and encouragement. It's a lot like counseling. So I want to encourage you to continue doing it. Do the simple things. Wash your hands. Stay away from other people. Only do those essential business that you want. Check on your neighbors by phone. Call them, check on them, especially your elderly neighbors, and check on them every day. They need to hear from you, and you also need to know if they're okay. So be a good neighbor. Once again, I just want to reiterate, we only want to do essential business with the essential people at the essential time. It's all about being essential for a short period of time so that we can restore our economy and restore our way of life. So thank you for the opportunity to be here. Thank you, Ricky. Thank you. We want to say thank you to our first responders. I've had an opportunity to spend some time with them at great distance outside the hospital and different things. Our health department, our governor, Department of Health, CDC. It is truly a team effort, but we have to continue to operate as a team. Thank you, Mayor, and thank you, Mayor.
Thanks, Ryan. We appreciate all you've done for Cookeville and Putnam County and advocating for us at the state. You know, you did a lot of work behind the scenes during the tornado response, and that most people probably didn't know about. I think I talked to you more there in a period of a couple of weeks than I may have we talk a lot, but I mean, it was multiple times a day. So thank you for all that you did for us and that you continue to do with us, communicating about this new challenge that we're facing.
I'd reiterate that. He was so valuable during the tornado and the partnership. You know, we always talk about our team, and Representative Williams is a valuable member of our team that helped through that. And I know he would not want me to say this, but I know for a fact he and his family purchased food and had it sent to the hospital for 2 or 3 different departments over there. And, you know, just the kindness of that, and, you know, showing kindness, as he said, to your neighbor, but, you know, showing kindness to these folks on the front lines. And I know he's done that on multiple occasions, but I know for a fact he did it about 3 times this week. So thank you, Representative Williams.
Mayor?
Yes. So as we've all talked about, it should not come as a shock that we're telling you this is a serious virus. Please take it serious. It's spreading, and people, even young people, are dying. No one is immune, but so many think they are invincible and that it won't infect them. It affects all ages, so we must stay home, and if out for a necessary need, physically distance. It makes a difference to protect the health and safety of your family and everyone else. Don't panic. Be supportive of one another. Wash your hands. Again, imagine that every place and every person are crawling with a COVID germ and act accordingly, or even that you are and act accordingly. Stay at home and away from people as much as possible. As we've all said, essential business. Don't take the whole family. It's not a field trip. It's not spring break. It's not vacation. Make reasonable, educated, common sense decisions. The sooner everyone follows directions and stays at home, acts responsibly, the sooner all this will be over. Again, for the most up-to-date COVID-19 information, links, and resources, visit bettercookeville.com. We will get through this. Again, just because something is essential does not mean that you have to do it. So be smart. Continue to pray for our country, our healthcare workers, and obviously our responders. Let's choose faith over fear. God bless.
Also want to make sure I say a thank you, too, for all our first responders, emergency services, law enforcement, hospital, health care. All these folks are putting their lives on the line daily, taking care of us. And I know that's a calling, and we thank you so much for what you're doing in taking care of our community and our citizens. Mayor Shelton and I will continue to do these live updates to keep you informed. Our next update will be Monday at 4 p.m. Next update will be next Monday at 4 p.m. Please continue to keep us as your community leaders in your prayers, along with our county, state, and our country. And I appreciate everything everyone's doing, and we just got to keep fighting this, and we will get through it. May God bless you and your family.
Thank you.